Eli Lilly makes a drug that helps people with diabetes, but recently, some famous people have been using this drug for a completely different reason, to lose weight and to look good in fancy clothes. This is called an off-label use, which means that a drug was used in a way that it wasn't originally intended. So here's the weird part. Lilly is now telling people not to use their drug this way. But why is it strange? So let me explain. So off-label use is completely normal. The FDA makes sure that our medicines are safe and knows that doctors sometimes use drugs for off-label purposes. In fact, it's a completely normal part of healthcare. Sometimes, using a drug for an off-label use becomes the best way to treat a patient. The FDA doesn't usually have a problem with this. Now, Eli Lilly has never made a fuss about off-label uses of drugs before, so why now? The reason is simple. They don't have enough of the drug to meet everyone's needs. This drug is in short supply, and Lilly wants to make sure that there's enough for patients who need it for diabetes. This seems inconsistent for Eli Lilly to suddenly be against off-label use. If they were always okay with it in the past, why change their stance now? It feels like they're more concerned about the drug shortage than about how to use their medications safely. And to me, as someone who actually defends the First Amendment, I find that to be a little inconsistent. So in summary, it's strange for Lilly to suddenly call out off-label use when it's never been a problem before. It seems more about managing supply than about actual patient safety or effectiveness of the drug. In fact, the drug is actually approved for this off-label use. So we need to ensure that companies and regulatory agencies are consistent and clear in their message to avoid confusion and to ensure that everyone gets the care they need. Thanks for listening. Let's keep advocating for what's best for patients.
This is the DarshanTalks podcast.